Hi, I'm Dr. Scott Conrad, a family doctor. I'm the medical director for the MyPHA program, and the PHA has asked me if I'd share some thoughts about specialists. Again, I'm a family doctor. I send people to specialists. And it is the most amazing thing to see what a huge difference there is between specialists. I now have a program on my computer where I can send questions to specialists all over the world that are the top doctors in their area. And I've tried to experiment a number of times. Like, for instance, I'll have somebody who has a set of symptoms and their doctor says you need surgery. And I'll take all of their symptoms, all of their x-rays, all of their lab work, and I'll send it to doctors in different parts of the United States. Some are at Harvard and Yale and Stanford and University of Michigan. Others are practicing doctors that are just seeing hundreds of patients every month. And you know what? They're not the same in what they recommend. In fact, sometimes I will get things that are as different as the East is from the West. And I'm not sure which is going to work better for my patient. So sometimes I will try this with a patient, doesn't work at all. So I'll try what the other doctor recommended, works perfectly. Other times I'll try what the other doctor recommended, doesn't work, and I'll try this and it works perfectly. Every person is different. You're different than other people. So it's important to realize that one specialist's opinion is one specialist's opinion. And it's important to get multiple opinions, particularly if there's going to be some sort of procedure or surgery involved. One of the things that I've gotten in the habit of doing is whenever a patient's been told you should have surgery on this, like your neck, your back, your hip or knee, or you need your gallbladder taken out, or not acutely, not if it's you're sick, but just, you have occasional gallbladder ache, and the doctor said we should go ahead and take that out. Or particularly in women, where they're recommended that they get their ovaries or some other part of their anatomy removed, I've gotten in the habit of sending off a request to a world-class specialist to say, do you agree with this? In fact, I usually will do two, so I get 3 opinions. And it's amazing. More often than not, there will be 2 of the 3 would say, I would not do surgery now. I would try this, and then I would try this, and the next thing, and next thing. And only if those fail would I get surgery. So it's really important for you, if you're recommended elective surgery, to strongly consider getting a second opinion and talking to another specialist. Great doctors aren't offended. They don't get all huffy because you talk to somebody else. They're confident in themselves and they want what's best for you. A doctor who wants what's best for you will never get upset if you get a second opinion. They may not agree with what the doctor says, but if you get one doctor that says do surgery and one that says don't, then get a third doctor that's not related to either of those and get a third opinion. It's your body. And once they cut skin, you can never uncut your body. And the best predictor of future surgery, particularly when it comes to a joint, is getting surgery now. It doesn't work frequently. And the doctor who's doing it, they have all the best intentions. And they've done the procedure maybe 50 or 60 times, maybe 200 or 500 times, and it's worked. But for every time it's worked, there are people, maybe only a handful, that it didn't work for. And you could be one of those. So doing the least invasive thing possible is really, really important. If it's pain that's driving you to get care, then go address the pain. Because getting surgery, I can't tell you the number of people that I've had that had neck pain that went to a surgeon, they said, we need to do surgery. I would say, hey, I want to try some other things first. Some of them would charge into surgery. So many of them, it doesn't fix their pain. Others would not, and more often than not, honestly, the pain would go away and they never got surgery. So please be careful, please be thoughtful. Once you cut skin, you can never uncut. And make sure you talk to multiple doctors, multiple specialists before you jump into any aggressive therapy. I hope this has been helpful, and I look forward to being able to support you through the MyPHA program. Remember, the PHAs will help you find the best possible doctors that they can so that you get great doctors to get multiple opinions from. Thank you very much.